Hello, my name is Dr. Gregory Davies, and I am a professor of Obstetrics and Gynecology at Queen's University and the president of Stittsville Medical Imaging Center, where we offer the MonaLisa Touch as a treatment option for the common vaginal and vulvar discomforts associated with menopause. The objectives for this presentation are to help you understand what is happening with the hormones in your body as you transition through menopause, and how the lack of natural estrogen production can lead to the common and distressing symptoms in the vulva and vagina. First off, I will review the normal female anatomy, both on the outside and the inside of your body. Next, I will educate you about how the hormone changes with menopause affect your body on the inside and the outside. We will then explore how replacement estrogen works as a treatment when you stop producing your own estrogen after menopause. I will then introduce you to the MonaLisa Touch laser treatment as an effective alternative to estrogen to treat these same menopausal symptoms. I will then summarize the clinical evidence to date that supports laser light treatment as a viable option for the effects of menopause on the vagina and vulva. I will show you a MonaLisa Touch treatment to the vagina and vulva performed on one of my patients who graciously gave her permission for me to demonstrate for you exactly what is involved and how it is done. And finally, I will explain how you can arrange your MonaLisa Touch consultation with me. Let's get started. Before we go any further, let's make sure we're all familiar with the normal female pelvic anatomy. The labia majora are the larger outer lips of the vulva. They are normally covered in pubic hair. The labia minora lie inside the labia majora and are the smaller lips of the vulva. Inside of the labia minora is the opening to the vagina. The urethra, where urine comes out, is above the vagina. The clitoris, the main site for female sexual pleasure, is above the urethra. Now let's look inside your body to see what the process of menopause is doing to your reproductive organs. Before menopause, the ovary is the source of the eggs you release on a monthly basis. When the egg is released, it enters the fallopian tube and travels through the tube into the uterus. If a pregnancy is not fertilized that month, the egg and the lining of the uterus is sloughed off and passes through the vagina as menstrual blood, commonly known as having your period. The ovary is also the primary source of your body's estrogen. The estrogen stimulates the lining of the uterus, getting it ready to accept the egg. Estrogen also has powerful effects on the vagina. As you can see in this magnified drawing of the vaginal wall, it is the effects of estrogen that attracts blood supply, which supports a thick and healthy vaginal wall, which is elastic and has the cellular structure for normal lubrication with sexual activity. When the ovary is no longer producing estrogen, the effects on a woman's sexual organs are rapid and profound. As it is no longer producing eggs, the ovary becomes smaller. The lining of the uterus is no longer stimulated by estrogen, and so a woman stops menstruating. There is a reduction in blood flow to the vagina, which then becomes dramatically thinner, losing its ability to produce normal lubrication with sexual activity. The vagina shortens and becomes narrower, which in addition to poor lubrication can lead to painful intercourse. The same process is also happening to the skin on the vulva. The simple explanation as to why you are having new vaginal and vulvar symptoms after menopause is that your natural production of estrogen is a fraction of what it once was. Let's take a look at what's happening. So let's imagine that this photo represents you, your production of estrogen and its effects before you went through menopause. In this example, The water going over the waterfall and the full river is the estrogen in your body. Before menopause, relatively speaking, you are producing gallons and gallons of estrogen. Just like in this image, where the presence of water allows the plant life to grow and be green and luscious, that's what estrogen does to your vagina and vulva. In the presence of estrogen, the skin of the vagina is lush, creating normal lubrication and tone. The vulvar skin is plump and has good elasticity. In addition, estrogen is important to providing tone and support of the bladder to avoid leakage. And then along comes menopause. The average age of menopause in Canada is 51. Not only does menopause cause hot flashes, but women also commonly notice more rapid aging to the skin on their face, a shift in where they carry weight, and increased challenges in keeping weight off. Within 2 to 3 years of menopause, at least 50% of women also notice that there is no longer normal lubrication in their vagina. Intercourse has become painful. Their vulva is dry and itchy, and they more frequently leak urine, get strong urges to pee, and have to get up at night to pee when they never had to before. All of these effects are due to the dramatic reduction of estrogen from the ovaries when the brain after menopause no longer sends the signal to produce it. The symptoms that women experience related to the low estrogen state of menopause affect the normally moist skin inside the labia majora, or large lips, on the vulva, which is identified by the dotted blue line. Typical symptoms on the vulva include dryness, itching, and occasional bleeding because the skin has become so thin that even minor chafing can cause a break in the skin. The opening to the vagina can be seen inside the dotted yellow line. The typical vaginal symptoms experienced after menopause include dryness, lack of lubrication during arousal, and pain with intercourse. So back to our water and estrogen comparison. Again, the water in this picture represents the estrogen in your body after menopause, but compared to the previous image, you can see there is much less water in this photo and therefore much less water around to sustain the plant life and lots more dry land. This is exactly what happens to estrogen production with menopause. It commonly takes a few years after menopause for the lack of estrogen to have noticeable effects on the vagina and vulva, but at least half of all menopausal women will have disturbing symptoms due to dryness and its consequences. The term genitourinary symptoms of menopause is used to describe the effects of a lack of estrogen on the vulva, vagina, urethra, and bladder. The typical symptoms from low estrogen of the vulva include itching and burning. When the vulvar skin gets very thin, there may even be some bleeding. The typical symptoms from low estrogen in the vagina include dryness, discharge, odor, painful intercourse, and bleeding after intercourse. Due to the lack of estrogen to the vagina, vulva, and clitoris, some women may have increased difficulty achieving orgasm. The bladder is also affected by the lack of estrogen after menopause, resulting in symptoms like recurrent urinary tract infection, pain with urination, having to urinate frequently, having to get up at night to urinate, getting strong urges to urinate, not being able to get to the bathroom on time, or leaking urine with coughing, sneezing, or exercise. Unlike hot flushes, which generally settle with time, the genitourinary symptoms of menopause tend to worsen with age. This graph demonstrates how quickly women develop genitourinary symptoms of menopause and how many women are affected. Prior to menopause, only 3% of women have symptoms, but within 3 years of menopause, almost half of women are affected by symptoms, and 60% of women with symptoms describe them as moderate to severe. One group that are particularly affected with these symptoms are women who have undergone treatment for breast cancer. As estrogen is not commonly used by breast cancer survivors, and removal of their ovaries may be a component of their treatment, they commonly suffer from genitourinary symptoms. 23% of breast cancer survivors have symptoms before menopause, and 70% after menopause. In this survey of 3,046 women with genitourinary symptoms of menopause, 60% said their symptoms affected their enjoyment of sex. 24% said their symptoms affected their sleep and overall enjoyment of life. Only half of these women had discussed their symptoms with a healthcare provider. Almost two-thirds of women were self-treating, buying over-the-counter creams and lubricants that only have short-term effect, and only 11% of women were using prescription estrogen. There are some serious negative consequences of having vulvar, vaginal, and bladder symptoms. Some 3/4 of menopausal women report negative effects on their sexual health, which can have an effect on their self-esteem and their relationship with their partner. In addition, affected women may avoid activities like exercise that can aggravate bladder leakage. So, it's time to start talking and doing something to improve or even completely get rid of the genitourinary symptoms of menopause. The standard treatment for the genitourinary symptoms of menopause is estrogen. It has been available for more than 50 years and comes in various treatment forms, which we will explore. In 1966, Dr. Robert Wilson was the first to recommend estrogen during menopause in his book Feminine Forever. This was soon followed by the introduction of a package of 2 tablets that included both the hormones estrogen and progesterone, which was called Prempro. Now there are many types of prescription estrogens available, either alone or combined with progesterone. Estrogen, either alone or combined with progesterone, is now available as a tablet, a cream, a gel, a vaginal suppository, a vaginal ring, or as a patch. Estrogen works well at controlling all the symptoms of menopause, including hot flashes. However, 40% of the women using estrogen by mouth or in patch form will still have vulvar, vaginal, or bladder symptoms. Estrogens used locally are effective for vaginal or vulvar dryness, but they won't stop hot flashes. Women using local estrogens commonly find that the treatment works well for their vaginal dryness, but less so for their vulvar symptoms. Overall, 80 to 90% of women respond to estrogen treatment. When women take estrogen for their menopausal pelvic symptoms, it reestablishes normal blood flow to the vagina and vulva. Estrogen enhances the tone of the pelvic structures, including the bladder. All of our skin is covered in bacteria, including the vagina. That's normal. Estrogen restores the normal bacteria in the vagina, reducing symptoms of itch and odor. Estrogen can improve the symptoms for women with urge or stress incontinence. Although estrogens are effective, they are not for everyone. Some women, like those with estrogen-sensitive breast cancer, or those who have had a blood clot in their leg or in their lung, cannot use estrogens. Some women feel uncomfortable taking medications that contain hormones and make a conscious choice to avoid them, even though they could be helpful for their symptoms. And some of the women who have tried using estrogen find it ineffective. Usually that is because they can't remember to take it as often as it is prescribed. To be effective, estrogens need to be taken continuously, and as soon as they are stopped, the symptoms will return in short order. Not all prescriptions for estrogen get filled. Only 25% of menopausal women ever use estrogens, despite having symptoms. Of these, almost 40% stop using them within the first year of treatment. Statistics Canada has identified that only 7% of Canadian women aged 45 to 64 use estrogens. So if estrogens have been available for more than 50 years, and only a few women are using them long term, then there is an obvious need for a non-hormonal alternative. Something that can have the same effectiveness as estrogens, but isn't hormonal, doesn't have to be taken regularly, and doesn't have significant side effects. Introducing the MonaLisa Touch, an alternative to estrogens for the treatment of the genitourinary symptoms of menopause. The MonaLisa Touch is a device that uses the heat-generating properties of laser light to treat the genitourinary symptoms of menopause in just a few quick and painless treatments, without the use of hormones. The MonaLisa Touch utilizes the Smart Exide fractional carbon dioxide laser to treat the symptoms of menopause that affect the vulva, vagina, and bladder. This novel laser therapy helps restore vulvar, vaginal, and bladder health by generating new blood flow, collagen, and tone. The MonaLisa Touch has two different treatment wands. One is designed to fit in the vagina, and the other is designed to treat the vulva. In this drawing, you can see the vaginal wand inserted in the vagina. Thousands of microscopic abrasions are created within the vagina. The heat generated by the laser light causes the body to mount a healing response that dramatically increases blood flow, collagen, and the cells that create normal lubrication, resulting in the same effects that estrogens have on the vulva, vagina, and bladder. Although the image on the bottom right shows the laser light entering the vaginal skin, it is important to remember that this is only to a depth of 1/1000th of a millimeter. In this magnified image of the vaginal wall, you can see the tiny dents in the vaginal skin made by the laser light. The body's healing response to these microscopic injuries causes a lasting return to normal lubrication and tone. These two images are biopsies of the vaginal skin seen under a microscope before and after 2 treatments with the MonaLisa Touch. Before treatment, the dark skin layer is very thin, and the supporting structure underneath the skin layer contains a lot of empty white space. After the second treatment, the dark skin layer is dramatically thicker, showing normal premenopausal cell growth and turnover. In addition, the supporting structure below the skin layer is much more dense, providing much improved support and strength. The red line on this graph shows the amount of lactobacilli present in the vagina at baseline and through 3 treatments with the MonaLisa Touch. Lactobacilli is the dominant bacteria in the premenopausal vagina, but falls significantly after menopause. With each treatment, the levels of lactobacilli rise, demonstrating a return to the premenopausal bacteria environment. The pH of the vagina, as seen in the blue line, drops with each treatment, which is also a normal finding in the premenopausal vagina. The MonaLisa Touch technology was first introduced in Italy in 2012. To date, thousands of women around the world have been treated. There have been more than 30 studies published about the MonaLisa Touch, all of which demonstrate very similar findings, meaning, like estrogen, about 80 to 90% of women have a dramatic improvement in their genitourinary symptoms. Given the MonaLisa Touch has only been available for a relatively short time, there has yet to be studies with large numbers of women, with most studies published so far having only 20 to 80 women participants. I will share with you the results of a meta-analysis, which is a scientific technique to pool the results of a number of small studies in order to better understand the risks and benefits of the procedure. Here are the results from 2 different studies. The table on the left shows the results from a group of menopausal women. After 3 treatments with the MonaLisa Touch, 84% of women described a decrease in vulvar burning. 85% described a decrease in vulvar itching. 76% described improved dryness of the vulva and vagina. 72% had reduced pain with intercourse, and 90% noticed their vagina had more normal tone. The table on the right is from a study using the MonaLisa Touch to treat the vulvar and vaginal symptoms of breast cancer survivors, and showed very similar results after just 1 treatment. Because the MonaLisa Touch only uses laser light and is non-hormonal, women with breast cancer can undergo treatment without the worry that it will impact their risk of the cancer returning. Here are the results of the meta-analysis that was performed in 2017 and pooled the results of 542 women from 14 different studies. The studies were similar in that all the women underwent 3 MonaLisa Touch laser treatments spaced 4 to 6 weeks apart. The results of this meta-analysis confirmed that after 3 treatments, women noticed a significant reduction in vulvar and vaginal dryness, a significant reduction in pain with intercourse, and a significant improvement in the Vaginal Health Index, which is a measurement of a collection of the genitourinary symptoms of menopause. The studies reported very similar results, demonstrating that after the 3rd treatment, 85 to 98% of the women who were not previously able were now successfully having intercourse. Lichen sclerosus is an uncommon skin condition that can affect the vulva. It creates patchy white skin that is thin. The common symptoms are itch, pain, and painful intercourse. Sometimes the skin is so thin that it will crack and bleed. For many women affected with lichen sclerosus, use of a potent steroid cream can put it into remission for various periods of time, but need for retreatment is common. Despite steroid cream use, there are some women who continue to have symptoms. There have now been a number of case reports looking at fractional carbon dioxide laser, like the MonaLisa Touch, to treat lichen sclerosus. The case reports show positive results with reduction or elimination of the lichen sclerosus without side effects. However, no large studies have yet been reported. There is one study that evaluated 50 men at 14 years after carbon dioxide laser treatment for lichen sclerosus of the penis. At follow-up, 80% of the men had no symptoms and no visible lichen sclerosus. 10 men had minor symptoms and 2 men needed further treatment. 3 treatments spaced 4 to 6 weeks apart is the usual protocol for treating the menopausal effects on the vulva. More frequent treatments may be required in women with lichen sclerosus. The exact treatment frequency would need to be customized to a woman's ongoing symptoms. Despite the lack of large studies to date, some women who have symptoms that do not respond to steroid cream therapy may consider the MonaLisa Touch laser treatment as an option. The medical evidence about the MonaLisa Touch to date has been very consistent. I have shown you how the laser light treatment improves the thickness and health of the vaginal and vulvar skin, demonstrating the effects of the MonaLisa Touch have biologic plausibility. I've also shown you how the MonaLisa Touch creates an environment for more healthy vaginal bacteria. And finally, I've shown you how treatment with the MonaLisa Touch has improved the real lives of women who have experienced significant reduction of their symptoms and improved intimacy. In the next few slides, I'm going to demonstrate how the laser is used to treat the vagina and vulva. The treatments only take about 5 minutes and are not painful. To begin with, I'm going to demonstrate the external probe on my own arm. Unlike treatment on the vulva, I have not put any numbing lidocaine on my wrist to demonstrate that the procedure is not painful. If you do not want to view the actual treatment, then just skip ahead to the next section to learn how you can arrange a consultation. Demonstration, I have the external probe on my arm. I'm going to do a treatment on my own arm just to show you that it's not painful. And it just feels like a little mild electric shock is the way I would describe it. And then you can see the markings there. It would be the same on the vulva when it was treated. Okay, so the first thing that I'm doing is just applying a little bit of lidocaine gel. This is numbing gel. And this is quickly absorbed by the tissues in the vulva so that during the procedure, we'll wipe it off just before we start, but during the procedure this will be much less tingly because we put this on beforehand. So now we have the probe. We're just inserting the probe into the vagina. And we're going to insert it all the way to the top. And in this patient, you can see that it's at ½ centimeter mark 4. And so I'm just going to fire the laser, turn to 2 o'clock, fire again, and then pull back 1 marking and turn again, and pull back 1 marking again. And we'll keep doing that all the way through the length of the vagina. So now that I have the probe in contact with her skin, and I'm covering the mucous membrane, I'm just going to make a treatment. And you can see the little pattern that it makes on the skin. And we're going to treat everywhere where the mucous membrane has not yet been treated, but you can see that there's a little marking gets made each time I do the treatment, so we know that we have the entire area covered. As there is no sedation or anesthesia, you do not need to have someone accompany you to the treatment. You can return to normal activities immediately after the treatment, and you do not need to take time off work. Some local discomfort on the day of the treatment is not uncommon. 20 minutes on and 20 minutes off of a sanitary napkin that has been soaked in water and put in the freezer can help. Application of petroleum jelly for the first day or two can avoid any rubbing on tender areas. There are no known major side effects from this treatment. Although most women do not experience any of the possible minor side effects, these do include spotting, pink, brown, or watery vaginal discharge, redness, swelling, tenderness, or discomfort with urination. Any side effects that do happen are usually short-lived and resolve within a few days. If you have had treatment to your vagina and vulva, then avoidance of intercourse for 5 to 7 days is recommended. If you have had treatment to your vagina only, then 2 days of abstinence is sufficient. In conclusion, the MonaLisa Touch fractional CO2 laser provides a promising, long-lasting alternative to estrogen for the genitourinary symptoms of menopause. Treatments take only 5 minutes and are well tolerated with minimal recovery time. Any side effects are minimal and usually short-lived. Many women will notice improved vaginal lubrication and less vulvar discomfort after just the first treatment. Now let's talk about arranging a consultation. Consultation and treatment can be arranged by calling the Stittsville Medical Imaging Center at 613-714-1000. Feel free to email us at monalisatouch@stittsvilleimaging.ca with questions or for more information. Treatment with the MonaLisa Touch is not yet covered by your provincial health insurance or third-party benefit plans. Please call 613-714-1000 to learn about our pricing. If you prefer to pay over time, we offer convenient financing through MediCard. It's as easy as filling out their online application. Approval is quick without delay to your treatment. Your receipt includes a statement that use of the MonaLisa Touch is for a medical condition and is not cosmetic surgery. Check with your accountant to determine whether this medical expense would qualify for a deduction at tax time. The MonaLisa Touch clinical results and medical literature to date make me believe that laser therapy to the vagina and vulva is going to do for women's sexual health what Viagra has done for men's sexual health over the last 30 years, and much, much more, because it doesn't just help in the bedroom, but treats all of the distressing genitourinary symptoms of menopause. So remember the 5-3-1 of laser therapy. The MonaLisa Touch treatment only takes 5 minutes. 3 initial treatments, spaced 4 to 6 weeks apart, are needed for maximal lasting effect, followed by just a single annual treatment for ongoing relief. I'm Dr. Gregory Davies, Professor of Obstetrics and Gynecology at Queen's University. I hope you found this presentation informative. If you're considering MonaLisa Touch therapy for your genitourinary symptoms of menopause or for lichen sclerosis, then call us at 613-714-1000 to arrange your consultation.